Okay, so we're just going to wait for everyone to log on to the webinar here. And while we wait for people to continue to log on, I'm going to start a poll. So as you enter, if you could answer the questions to the poll. We'll also ask anyone who's viewing this webinar this evening, if you feel comfortable, just share in the chat where you're coming from. We'd love to hear where our RPNs are checking in from across the province. So feel free to put that into the chat, and I will start the poll here in just a moment. So the poll is up and running. And we'll just give a couple more minutes for anyone who's waiting to join. See some poll responses coming in. So if you haven't, if you're just logging in now, we're just starting a poll to start off the session. And it would be great if you put into the chat where you're logging in from. We'd love to hear where you're coming from across the province and where you're tuning in from. And we'll share the results of this poll in a little while throughout the presentation. So without further ado, welcome to the WeRPN quarterly research webinar titled A Thriving Clinical Practice, Finding and Using Clinical Practice Evidence. Tonight, we will be highlighting a method to find and use evidence to enhance your practice. Please submit any questions that you have in the question and answer section at the bottom of your Zoom screen. It can be found on the toolbar at the bottom. And we will have time for discussions and your answers for your questions throughout the presentation, but we'll save most of them for the end. I will now ask Annette Weers, the Senior Director of Professional Practice and Research at WeRPN, to begin our evening.
Hi everyone, and thank you, JP. I'd like to welcome you to our session on finding and using clinical practice evidence to enhance your practice, which is the focus of tonight's webinar. As presenters share their knowledge and skills, our objectives are to understand what is critical appraisal, what is the hierarchy of evidence, how do I find research, and how do I read and interpret research. The presenters will demonstrate and guide our panelist, Christina, and the audience through a step-by-step process on how to find quality evidence and research articles. We are going to use an interactive format with the panelists, and they're going to demonstrate the process, articulate the pitfalls, and the use of effective tips. As this is a two-part series, the second webinar will focus on participants using this process, so we encourage you to return on April 5th with an article that you've selected. At this session, you will have the opportunity to discuss the article with our speakers to gain their insights on your interpretation. And as you all know, as nurses registered with College of Nurses of Ontario, we are expected to use evidence-informed practice. And knowing how to interpret quality research and articles is a skill that supports our patients, clients, the teams we work with, and our own practice. So we hope this two-part webinar series will help you gain knowledge and skills as you review literature. To begin, I would like to introduce our panelists for the evening, Christina Kahn, Ben Hartung, and Jen Calver. So our first panelist is Christina Kahn, a full-time RPN. Christina's love of nursing comes from wanting to make a difference in the lives of others. She graduated from Fanshawe College in London in 2007, and has experience in the long-term care sector and working with Canadian Veterans Care. She is now engaged in working in the Neurological Stroke Rehabilitation Unit at Parkwood Institute in London, engaged in her clinical passion where she has the opportunity to see the gains that the patients achieve. Christina is also committed to supporting nursing students on her unit and enjoys new challenges. In 2021-22, she was awarded a RPN Research Fellowship and had the opportunity to participate in a research project where she shared her RPN expertise with the research team. Next, we have Benjamin Hartung, who is a registered nurse and who has supported WeRPN's research mandate. Ben has truly been a long-standing and strong advocate for RPN representation in nursing research and RPN's participation in leading nursing research. Ben also developed the new e-learning course for RPNs called Introduction to Nursing Research that is available through the WeRPN e-learning education program. And our final speaker for the evening is Jen Calver, an outstanding RPN, I'd say, and a lifelong learner. She's completed a baccalaureate and a master's degree and is still going on, currently a PhD student in health sciences at Ontario Tech University. Her work is focused on supporting the care of older adults and their care teams, including resilience and the impact of COVID-19 on healthcare practitioners. Jen was awarded a WeRPN 2022-23 RPN Research Fellowship, where she has joined a research project exploring staffing stability in long-term care, led by Dr. Winnie Sun, also from Ontario Tech University. And with that, I'd like to turn it over to our amazing presenters for the evening.
Hello, everybody. Thanks for joining us this evening. So we're here to kind of talk to you about different problems that you kind of might experience in the workforce right now. Something that we have discussed as a group right now that we're finding is a big situation is the whole IPAC involvement surrounding COVID-19 guidelines. So for those of you that don't know what IPAC is, it has to do with infection prevention and control, and that can be in hospital setting, community, long-term care facilities, or wherever you might be working. What I've kind of found has been quite a bit of a challenge for myself and my colleagues where I work currently, is just like dealing with the constant changes surrounding COVID-19 guidelines. It just, trying to figure out, okay, well, who do we go to for this information? How do we decide what is best practice for us as nurses, and as well as the best outcome for our patients? So that's what we're going to be talking about this evening, and just trying to help you kind of break down ways of trying to find that knowledge and kind of move forward from there. As you all are very well aware, we're going into years later with COVID-19. So we are definitely trying to move on from it, but it's still a thing and it hasn't gone away. So we still have to protect ourselves and our patients, and try to make the workplace as safe as possible surrounding that.
Great, thank you, Christina. So I think the next thing we're going to look at is our poll. Okay, thank you, JP, for posting those. Can everyone see the poll in front of you there? So we have a lot of folks joining from long-term care and retirement home sector, acute care, rehab and home and community as well, some private practice, and then a few people from non-traditional roles. So a good variety of people joining tonight. It's great to see. Looking at question 2, we wanted to gauge how comfortable you guys are feeling about using research to improve or to change your clinical practice. So we have kind of a mixed group here, which is good to see. We have a few people that are feeling confident, somewhat confident, and then a few people in the middle. So that's totally fine. We don't expect everyone to be confident. So I'm glad to see we have a good variety of folks here. Going on to the third question, looking at how confident you're feeling about finding research articles to improve your practice. So going to those good sources and accessing research. Again, it's looking like we've got some confidence, which is great, and a few unsureds. So we're hoping by the end of this session, and if you can attend the second part, you'll be feeling more confident with your ability to find and access research. And the last question there, focusing on how confident you are with reading and understanding those articles. So again, we're seeing some confidence and some unsures. So that's great. Thank you for participating in that poll. And we will move on with our presentation. So I'm going to do a little overview about research and evidence and how to find the best types of articles that we can use to help influence our practice. And then we're going to jump back with Christina and Jen, and we're going to look up and how to find some articles ourselves that we can use in practice and really ask some critical questions around those articles to decide, are they good and good ones to use. So what is evidence? We'll use the word evidence, research, best practice, articles, and we use all those words kind of interchangeably. But evidence is a reliable source of information that can help us to improve practice. There are different types of evidence. We have really, good evidence. We have even better evidence. And at the very top, we have the best evidence. So what does that mean? So looking at the base layer there, these are expert opinions or research articles. So that piece of paper you can find that has all that information digested into it. The lower level or the good level is really where we have one person who gives their expert opinion. So if you want to find how can I prevent falls in my long-term care home for people who have dementia, a very specific question, there's probably some articles out there where one person who is an expert in the field has written a paper, and that's really good. But there's better evidence. So a one-person opinion piece might be biased, and it's not necessarily based on the study, it's based on someone's experience. So it's good, but we can go to the next level, a better form of evidence. And this better form is when we have an article or a study that has actually tried an intervention, tried to do something, and then they've measured it to look at the outcome. So again, if we're looking at reducing falls in long-term care amongst folks who have dementia, a study that is in this range, the better range, would have looked at a group of residents or participants, have done an intervention, and have followed up to really get some rich data to give us ideas about how we can improve practice. And in that range, we have different types of articles and research we can use. We can use, or we can find qualitative studies, so studies that evaluate based on people's experience. So a lot of words and subjective data in those qualitative studies. We have quantitative studies where it really looks at the numbers. So if we're going to falls, falls rates, falls with injury, things like that. And then we can also do or have more robust studies that we would call randomized controlled trials or quasi-experimental studies. And it's really important to know that these are really great types of research, but it only focuses on one group of participants, one setting, one long-term care home in one country. So it's taking a small snapshot of the possible interventions. The next level is the best option. So as nurses, we're busy. We have a lot of competing demands on the floor and at home. When we want to find evidence or research to change our practice, we want a one-stop shop. And that's why I love literature reviews or review articles. These are single papers that have looked at 10, 15, 20 articles, and they have done the work for you. They've read them, they've critiqued them, and they've picked and pulled out all the great interventions and ideas and put them into one nice, concise document. And we call those literature reviews, and they're really great because it's that one-stop shop that we can rely on. So I like to think of the different levels of the hierarchy of evidence in a way that's a little more applicable. So let's say you're going to Niagara Falls with the family this weekend and you want to find a hotel. Your first option is getting expert opinions. So that's that good level. You're going to call your friend that went there last weekend, see what their thoughts are. You're going to maybe call up some hotels that you've seen on Facebook or Instagram. And that's great. One, it's a lot of work. 2, you might get biased opinions because your friend might prioritize pools and the water slides. You might be worried about or concerned about being closer to the good food. So it's a good option. The next option is you can actually go to the websites of the different hotel chains, and you can look up there to see, the best rates, what amenities they have. Little less time for you to do, good quality information, but you might be missing out on other different hotels in Niagara Falls. So the third option, which is the best option, is using one of those websites like Trivago or Expedia, where it has looked at all the hotels in the region. You can filter based on pools or close to food, and it saves you so much time, and you're able to get a non-biased opinion, all the options, and then you can make an educated decision about what type of hotel you want to stay at. So the same kind of different levels, we can consider a good, better, and best level for research articles. And those best ones really do look at one article that has done the work for you. It's looked at those 20 articles in one, and it's giving you a nice package so that you can use that evidence to make a decision. So a good example is, how can I reduce burnout from COVID-19? This is the question we have been living with every day, something very real to us. So there's many expert opinions out there, from physicians, from nurses, from social workers. Those are great, but that's one person's opinion about how you can reduce burnout. There is an example of a study there about using diaphragmatic breathing relaxation training to help improve sleep quality amongst nursing staff during COVID-19. Really great study, but it's only one intervention. So when you choose that article, it's only giving you one option, which is good, but that might not be the right option you want to implement for your practice. So going to the best section here, we have a systematic review that is focusing on factors about nurses' intent to leave acute care hospitals. And within this article, because it's a systematic literature review, we know they're going to give us many interventions that can help us to decide which are the best ones to implement for our practice. And articles like this, the reviews, have looked at 10, 15, 20, 30 of the lower level articles. So it really does help us save time. So let's say we have found an article that addresses an area of practice we're concerned about. So let's go back to maybe falls prevention and dementia care in long-term care. How do I know that the article I'm looking at is high quality evidence? Because we don't want to just implement any research or any article into practice. We want to make sure we're implementing evidence that's good quality. So we call this process critical appraisal. And the formal definition is a careful examination of all aspects of studies to judge their strengths, limitations, trustworthiness, meaning, and applicability to practice. So we want to ensure that we are looking at the authors, do they have credentials? Are they nurses? Do they have advanced degrees? Where are they working? Where did I find the article? Did I find it by Googling it? Did I find it on Facebook? Did I find it on Twitter, on TikTok? All of those things matter because we want to find really good articles and preferably articles that are peer reviewed. So what goes into a really good article? How do I know if I'm going to find a really good article? So it's important to have a little understanding about how evidence or research articles are created. When we look at all the information out there, it's hard to sift through to find really good quality information. But we really want to look at an article that we consider peer-reviewed. So that means that someone writes an article or does a study, writes an article, and creates this document called a manuscript. And that manuscript goes through a peer-reviewed process. So they submit it to a nursing journal. We're going to look at a few nursing journals and databases after this. And that article is going to go off to really good experts in the field. They're going to read the article, give critiques, and that feedback is going to come back. The author is going to incorporate that feedback, and then it gets released into a nursing database where you can access that article. So we're going to talk about a few different databases next that are free and open to use. And that's a really good spot to start to look for evidence that we can really trust. And it's quite easy to give it a check mark that, yes, this is reliable evidence, and we can ensure our critical appraisal is done. As you can imagine, if you write something on Facebook or write on a blog, it's not going to anyone to approve it. It is going into the world, and even if your intent behind it is good, it might not be that evidence-based. It might not be something you want to trust. So we really want to ensure that we are getting peer-reviewed articles that have followed a similar path to this. And that's how we can know we are getting really good evidence, because at the end of the day, the interventions we put in place to help prevent falls with older adults who have dementia and long-term care, we want to make sure we're keeping everyone safe, and we want to ensure that those interventions are based in evidence. So now that we have a little bit of background of the different levels of evidence and how evidence is created, we are going to show you a few different databases of where you can find research. And then we're going to have a bit of an interactive discussion where we're going to look at an article and decide, if it is good evidence for us to use to address the clinical question. So I'm going to turn it over to Jen here.
Thank you, Ben.
You're welcome.
Do you mind just holding up that slide just for a minute, and then I'll go into, I just want to talk about the graphic there.
That one there?
Yeah, that's great. And I really enjoyed, whenever we sit in on some of these sessions, we always have a takeaway, and looking at that good, best, and better, because of, we're constantly getting an influx of information, and it's just like you said, where do we start? And Christina's topic earlier, when she's mentioning the case study and her experience working through the pandemic and all the other things that go into that and how big that topic is. So hopefully we can start to unpack and drill down into some of that when we do the interactive session. With these databases, we don't always have them at our fingertips in our clinical practice, especially, I say, at point of care, when you're really interacting with patients, residents, clients, and families. So how do you access some of these databases at work or at school? And you know what? So there's great news, because there is open access articles that are available to us here. And the subscription databases that you see up on your screen there, PubMed, Medline, CINAHL, are some of the examples of these subscription-based databases. And so what this means is that once that manuscript gets accepted and goes through that rigorous peer review process, the journals will sell their articles to these databases. And if you have a membership to these databases, then you can access the journals. And these subscriptions kind of go to colleges and universities or organizations. And so there is an opportunity for nurses in your practice. Check with your organization and see if they have a subscription. The other way that you can maybe look at accessing these larger databases is a lot of schools where we've done our training, where we have that alumni status. If we contact the librarian, they might be able to help us get access to some of these larger databases. Especially if there's something, a new health condition or something that's really sitting with us, and we know we really want to unpack that information for ourselves. And so we can follow that road. these open access journals that we're going to look at today come from this movement of making research more accessible and using it in our everyday practice. And these open access articles, they are the same quality as traditional public articles that are maybe stuck behind these paywalls that are a little bit more difficult to access. And there are several journals out there that will solely publish open access. So what we're going to do here is I'm going to share my screen in a moment, and we'll go into the Nursing Open Access Journal, and we'll kind of go through that step by step. And if we have time, we can also go into Google Scholar. I'm not sure if anybody that's attending today has tried to navigate Google Scholar, but I know for myself, when I first started jumping in and navigating it, and I got lost. So we'll have some time to kind of go in and look at some of those basic search strategies and maybe bumble through what I started doing and then kind of where we've come from. So I think I have the power to share my screen. Okay, sorry, Ben, I'm going to push your slide out. There we go. And everybody can see my screen okay?
We can see it, yes.
Excellent. So let's start with Nursing Open. And you can see that it's one that I kind of visit, so it's here. So if you're comfortable to put in the chat, I'm curious to know if the people attending have visited this website or a similar website. So Nursing Open is part of the Wiley Online Library. And what's really great about it is that you can kind of keep up on what's trending in the literature. So you have your navigation bar. If you scroll down, you can look at what the most recent publications are. So these are hot off the press. I mean, this one was just yesterday. And from the slide that was shown earlier, we can see the type of the article type listed right here. We can access the abstract, which will give us a snapshot of the description. And then if we're like, yes, this is the article, we can go into it. So you can see that Nursing Open offers, empirical, so quantitative research. They have a clinical trial here, so that might be interesting, especially if we work with kidney disease. Qualitative studies. We know nurses, we really learn from our experiences and those shared stories. So these qualitative studies might help make sense and assign meaning to some of this data that we keep getting this overloaded with. Helps unpack it a little bit. So with Nursing Open, also you can see what the hot topic. So you can go into the most cited. And COVID-19 is a hot topic right now. We can see it's impacting a lot of nurses. And then Ben, you mentioned COVID-19 burnout. The second article that's being really cited in this particular journal is all about COVID-19 undergraduate students and depression and anxiety. So there's opportunities, there's a systematic review. And then you can say the top downloaded. So now, people have gone in and they're like, yeah. And so now we can see what they're actually downloading and going in and taking time to start to drill down, which I think we'll do more in the second part of this webinar. But let's look at Christina's situation that she presented. So we're at work, it's busy. We have the people that we're caring for are calling on us. So we know we have things that we have to get done. And we know that, tensions can be building, or we really want an answer. And it's sitting with us. And so now we're at home and we have some time to kind of just, I guess, navigate and try to find some answers for ourselves. So with Nursing Open, you can go up to the search bar here. And Wiley Online Library is huge. It has a lot of journals. So with this one, if we're interested in just this one, which we'll look at just today, but if you're interested on your own, please feel free. You can search anywhere and see if you can find another open access journal. But let's just type in COVID-19 and see what happens. So COVID-19 gives us 274 results. I only have an hour. I don't want to read 274 and I don't want to comb through them right now. So I want to get a little bit more, maybe a little more specific. So now I can go back up here. I want to check this box again because I only want to look at nursing open. And then I can go into advanced search. So now I can take a bit more time with my search or get a little bit more specific with what it is I'm looking for or what my question might be. I can see that I'm only looking at nursing open. I only really want to look since COVID started because it's the changing guidelines is what I was getting from Christina's case study there, is that things just keep changing and I can't keep up and it's getting frustrating. So let's put in, I don't know, what is it, December 2019, maybe just before.
What if I wanted to search for something like dementia? Dementia's been around for or dementia and falls. That's been around for a very long time. How long should I go back? I don't want to be searching for 20 years of research.
You might. Well, I guess that would be your question. You might want to look back and pull up an article that was 20 years ago and then see how the practice has changed. Or maybe you're most interested in what's been newly published in the last 3 years.
Right. Okay.
So I think it just depends on what your question is. And when we go into Google Scholar, we'll look at some of those filters as well. Yeah, that's a great question, Ben. Thank you. What did we want to look at, Christina?
So like, I think like I really want to find out about like, because I work on a rehab floor, of course, with stroke patients, when they're isolated to their rooms because of COVID-19 situations, they don't get to go to the physiotherapy gym and go out of their room. So a lot of the therapy occurs in their room. So how is this affecting them, right? And what's the best way to kind of get around it so they can maximize their rehab potential?
Yeah. Okay. So maybe we'll look at rehab. So we can do rehabilitation hospitals or centers.
Yeah, I think that sounds good. And then just like about isolation surrounding that, right?
Like patient isolation, confinement, maybe let's try that one.
So it sounds like based on your clinical scenario, you try to pick out different terms, search terms. So
yeah, that's
isolation, rehab, COVID, those are kind of the main search terms you would use.
Yeah, I think it's good practice to think of the question that you're asking, because if we go too big, like when we're listening to the experience around dementia and falls, or we're listening to patient isolation or admission guidelines, or the topic is so broad that it'd be like you said, you could pull up absolutely millions of articles. So the more specific we can be, the more centered or concentrated our results will be. And you can always play around, because you can always go back into this. So let's see what comes up on this one. So now instead of the 274, we have 18 results. And we can see, there's psychological impacts on nurses. So this is a narrative review, so it's a little bit more focused review. This is looking at long-term care, so that's not what we were looking at here. We were looking at rehabilitation. So you just kind of go through and look at that. Is there any questions about this database? Because I want to kind of jump over to Google Scholar. So, and you want to pay attention, yeah, as Ben mentioned earlier, to the publication dates.
So I'm just wondering, all of the articles that we're looking at, we can probably guess they're all peer-reviewed, trustworthy articles because they're in the database.
Yeah, so journal on that last slide there, it does go through, usually it's two, three, sometimes more reviewers, and they'll pick apart the manuscript, and they'll really center on the method of it and ask questions if there seems to be something that's not quite right, or maybe could be further elaborated on, and they will send it back to the original study team and ask them to either revise it. Maybe they'll just say, no, you know what, it's not a good fit for this journal, or they say, welcome to our journal.
Right.
So,
Okay.
yeah. So, I mean, you could go in and so so this one here, it's a SWOT analysis. So if we wanted to look at new ways of doing a strength, weakness, opportunities, and threat analysis around COVID-19, and we want to know the lessons learned, then we might be interested to drill down into this. And so we would kind of take our time here at the abstract. And I usually, when I first read, I skip the beginning here, and I want to look at the methods. I want to know how many people participated in the study. And we'll talk about this maybe more in the next. I want to kind of know what their concept was, or what they were looking for. And then the results. So this one here, I might read it for interest, but if I really wanted to look at a tool I could take back to work, I might close this one and move on to another one until I get a little bit more information, and then come back and see. So go to Google Scholar. So I see somebody hasn't used the Nursing Open before. Has anybody tried to search on Google Scholar before? So Google Scholar, let's put in the same search terms. Let's go. COVID-19. This is the number of results we get. So that's a lot higher than 274. And we can see, we have the cited by is how many articles have taken it and used it as evidence. So Google Scholar is new for some of the attendees too. So let's narrow it down a little bit. So because I'm interested in this pandemic, I might want to use some of these filters on the side, and maybe since 2019. And because of my time, and I really want to see everything that's out there, and I want to access those review articles that Ben was talking about. So we can see just by changing the year since they've been released, and changing the type to review articles, now it'll only pull up the different kinds of reviews. I've drastically reduced the number of results, but I still am not going to sit here and read that many articles. So let's narrow it down a little bit. So we want to put and. So we have our concept. So we have the area that we're interested in looking at. Now let's give it a location. So let's put in rehabilitation hospital. Maybe I'll also do an or rehabilitation center. And so we can see we're getting down there a little bit smaller. So you just play with your search terms and really think about the question that you're asking. And then our last one was isolation. And we can see we're getting down there. Maybe we want to look at just in the last year. Now we have 580 results. So Google Scholar, I like it when you log in to it at first, that you can see. So these are so new. You can see that the citations aren't there because there hasn't been an opportunity for people to go in and replicate their studies or to use them as in their papers, or maybe they have and they're not past the peer review process yet. When we go back, we look at the 3 years, you can see the numbers are starting to get up there. So this one's been quite popular. It was published in 2020, so still fairly recent. And it's actually looking at psychiatric hospitals in China and the managing mental health. So it's not a rehabilitation hospital, But do we want to know, do we want to look at the mental health and what China's doing for mental health? Maybe. Maybe we want to look at rehabilitation medicine, lockdown disparities experienced with people during the first wave of COVID-19.
Jen, what kind of things would you avoid? Like, what are some like things that kind of stand out in these like searches that you would just be like, okay, that's not it, just to help you kind of narrow it down a little bit better?
Oh, that's a good question.
Because so much stuff comes up, right? And I think that's what people struggle with the most probably, is that you get all these results and you really have to narrow it down with those and operators, right? So into the terms that you're putting in there, so you know what you're looking for, and then you get the best outcome, right?
Yeah, I don't know if it's about maybe not avoiding things necessarily, but really being more specific. So right now, COVID-19, we saw it was a hot topic. Maybe I wouldn't use COVID-19. Maybe I would use infection prevention in the last 3 years. And so maybe I would just play around with my search strategies. I don't know, Ben, from your experience, is there anything with the search strategy that you would avoid?
Yeah, it's a good question. Yeah, I like the idea of playing around with the terms, and as I'm scanning the different, the different headings, I'm looking for something that's relevant to me in my practice, because just because an article looks, exciting and interesting, doesn't necessarily mean it's going to apply to my practice. So I like the ideas of having the date ranges, clicking on review articles, and trying to put enough search terms in there where you're going to get some links to articles that are relevant to me.
Yeah, so we can play. That's kind of where I was sitting with that too. I think that's a really good question though, because you're right, Christina. I mean, you could get lost in it. I guess maybe because there's so much information out there, we wouldn't want to spend or let ourselves kind of get overwhelmed or absorbed by how much is out there. So looking at, trying to stick to looking at the articles that answer our questions. So patient journey recommendations. So this one here might be interesting. It's a new article. It's already been cited 4 times. It's looking at COVID-19 and infection prevention to avoid the virus spread. Just see a question in the chat from Nancy. Asking, how do you know that an article is accessible? So that's a really good question. So I'm interested in this one, so we can go into it. And it's here. And this one's giving us an option to download articles. So the downside with Google Scholar is sometimes we hit those paywalls. So this is when, if it's something that we're really interested in and we want to read it, then we might want to reach out to our librarian or our school and keep track of it that way. So this one here, cookies. So this one here is giving us the option to download it. So we can just download it and we have it in a PDF. And then we have it and we can kind of go through it that way. So the journals are here to the right. So you can kind of, as you get more comfortable using Google Scholar, you'll get to more familiar with some of the journals as well that you'll be able to access. So there's another one that we can see that's of interest. We can go and I'll see if I can find one with a paywall here. So this one comes up and we can create it into a PDF. So this one here is not a final publication. It was accepted. So this hasn't been completely through the editing process. So
there's a question in the chat to the panelists about, how do I know that the article you pulled up is trustworthy and one I can use? So that's a good question. I guess, do you want to go back to the one you just downloaded there, Jen?
Sure.
Yeah, so things that we look at are the journal itself. So Frontiers in Aging Neuroscience. We want to look at the authors themselves. So we see a bunch of names and little numbers beside their names. So just below, they're all linked to different organizations. So we see people from the University of Alberta, McMaster University, a lot of different colleges, universities, health centers. So it seems as though that the people writing this article are experts in the field. And then knowing that we found it on Google Scholar, another source, those are all really good signs that this is a good article to use. And it's pretty recent, it's from 2022. So another indication about, yeah, this article is probably trustworthy and something I could use if it's relevant to my practice.
That's a great question. We can see if we can find. This one here is offering us that recommendation. So let's see. So Journal of Rehabilitation Medicine. So this one might be of interest, Christina, to help you answer some of your questions. We can see it's got the authors. So some of the articles, I know I was looking at one article about healthcare, and there wasn't one healthcare professional on the research team. So a question that would make me question, like if you don't have healthcare experience and you haven't been a practitioner or in a management or policy capacity, where is your knowledge coming from? Oh, so this one here. So this is a literature search. They use PubMed, Google Scholar. I'm not familiar with that database, but there's a lot of the databases out there. And Cochrane database is a very common one that's used for literature reviews. So they comb through 2,800 articles.
There's a question in the chat. I'll read it, and Christina or Jen or myself, we can decide what advice we have here. So how do I bring forward these research ideas or these research articles in my workplace to reinforce change? I tried to push forward a motive at the height of the pandemic about research that was proven that team-based was not the best approach to address staffing, but it fell through the cracks. And I think my role as an RPN had a lot to do with that. Well, first of all, that's amazing to hear that you found research about an initiative relevant to your practice, and you had the drive to move that forward. Any thoughts, Jen or Christina?
Yeah, I think this can happen a lot. Things get so busy and we find something, we want to push it forward, and it feels like the idea isn't being integrated or implemented. So one thing I can offer is that everything takes more time than I think we want, because everything feels so urgent when you're trying to help people and you're really giving into your nursing practice. So when you find something that, so team-based, I'm not sure what sector you work in, but team-based is very much something that's integrated into the healthcare system. There's a lot of team-based approach. So I'm not sure what the strategy was, but it would have been maybe a new strategy or a new concept that people might need some time to adapt. So if it's something that you really believe in, and that you have your evidence, and then a question, is it an evidence from one article? Is there multiple research to back it up? Does it match your organization and the culture in your organization and the direction that you want to go? So there's a lot of things, I think, in that question that could be further unpacked. And another avenue is, why do you think that this approach hit a wall. And that itself could have multiple answers.
Yeah. I think, Mandy, keep going forward, right? The more you are the spokesperson of research in your organization, the more people are going to listen and try to find those champions, whether it's a coworker or an educator, your manager, or a quality improvement person. Let them know that you're interested. And I know the WeRPN has that intro to nursing research, demystifying nursing research, and part of that module and that course is how do I get champions on board? Because making change is a lot of work, but research is at the very start. So don't give up. You will get there.
I was just going to say the same thing. Totally agree with what Jen and Ben are saying. You're definitely the drive, right, behind that. So if you can bring forward all that evidence-based practice and you can show, you know, how it's going to benefit your organization, I would definitely keep pushing for that. Just, you know, keep talking about it, keep you know, going to your senior management. I'm assuming that's who it is. I'm sorry, I don't know what area you're working in, but there will be a management of some type there, and just bringing forward your ideas and your concerns, because at the end of the day, it's always about the patients. It's always about what's best for the patients. And of course, you know, nurses want to have an amazing workplace and things to run smoothly, but we always have to look at for what's best for the patients. So if that's something that's going to benefit the patients, then continue on, go all the way with it.
For sure.
The only thing else I'll add to that, because that's it. And I love seeing nurses, you know, when we come to forward, because this is advocacy. What I'm reading in this question is advocacy, which is a huge part of the role of a nurse. Sometimes when we're working in these environments that we've been working in right now, simplifying or introducing it to small steps might be a way to help integrate some of these ideas as well. And really unpacking maybe why people aren't receiving this. Because I mean, maybe there's a root to the idea, but maybe it has to have some more limbs to it to fit with where you're trying to go with your practice or with the team's practice. So thank you for your question. That's a really great question.
Yeah.
So if you have the evidence or the research there and you wanted to unpack it in the next webinar, Mandy, make sure you bring it with you when you come to the next stage, and we can always pull it up and go through it.
Yeah, that'd be interesting.
Yeah. I know staffing's probably a hot topic. Well, staffing is a hot topic right now.
Yeah. Another question that came into the panelists is, now that we have an article that might be relevant, where do I start? How do I read it? Are there areas I should be looking at first?
Yeah, so that's a
good question.
Yeah, and I know we're gonna spend some time looking at that. But I would look again, I always go to the methods because I want to see what they did, and the abstract here doesn't give us much information. But you know, it's a literature search, so you can, I don't know how if you guys do the same thing when you read it, but I like to skip down. And okay, so now I know it's a systematic review. So I know that it has some sort of quality assessment, or I'm expecting to see some comparison of articles and analysis of the articles as we go. And you'll get used to these terms. And there's a lot. If you like, I want to know what a systematic review is, just you can Google it and you can pull up the differences. So there's a meta-analysis. So you can see kind of all the rigor and quality that they have to do there. And then they'll break it down. And then I'm like, okay, this article is going to give me the information. I feel like it has bones. So now I'm going to go back up to the top and I'm going to read it.
Right. Yeah, because I guess you don't want to waste your entire time reading an article that might not be relevant.
Yeah, not if there is a few. So maybe I just pulled up on Google Scholar 10 articles that all look like they might be of interest, but I don't have time to read all 10. That's when I might look at the abstract and say, okay, well, this one here, This one here says it's a little literature search. Doesn't really give me much details, but the next review pulled up, they give me really good details. I know how many reviewers they had in here. I know, kind of their inclusion criterias and their exclusion criterias, and they're just giving me more details. So I'm going to actually start with that one because I have more information going in. Scholar. And I mean, there are other open access journals as well. Like I know there's some Sage Open Nursing. I think there's there are lots of other journals out there. So, if you hit a paywall, these ones are all pretty good actually. Google Scholar at the bottom will also give you some suggestions related to the key terms you put in. So crisis management in private and public hospitals. So you know what? Part of the issue that we were interested in was some of the management and the changing guidelines and how. So maybe we want to click on that. And good practices. So this one here is clinical based if we wanted. So that could help too. Any other thoughts or anything else that you wanted to look at on Google Scholar or Nursing Open?
Yeah, I think that gives us a good idea of where to start to look for articles. Christina, based on your experience with your clinical problem and looking at IPAC and infection control and rehab and COVID, do you feel like these tools would help you find some articles that could be used in your practice?
Oh, absolutely. I definitely think so. It's just a matter of like getting the right wording in there to narrow it down and making sure that it's, legitimate articles, that they're scholarly articles, that the information is going to be accurate, that can help us kind of move forward from the issues that we're dealing with surrounding that, right? So yeah, but definitely, yeah, as long as you're going to, like something like Google Scholar or like legitimate websites to do this, I think it would be okay. So I think just helping people know what are the best sites to look at for research articles and kind of things to avoid, just like red flags, even what Jen was talking about, like, okay, so none of these people have any healthcare background or experience. So like, what are they talking about kind of thing, right? So yeah, I definitely agree with that 100%.
Yeah.
We see that a lot with media releases, don't we? We
Yeah.
come across an article on either social media or maybe even a podcast, or we're listening to it going, wow, this is really interesting. And then you start to think, well, what's the roots of this? Is it? And then if you can think back to that model on that slide, is it good?
Yes. There's
Or
a lot of that out there. Social media is just blowing up with stuff, right? So, you just have to kind of know how to differentiate that.
Yeah. I think there's.
And I also like to think about, finding articles, finding research as a skill, and skills take time to develop. So it might feel like it's rusty now trying to find good articles, but just look back to your first dressing change and your first, sub-Q injection. Your hands were shaking. You weren't sure, how to clean, how to measure properly. But the more you practice, you'll get more confident at finding good evidence that you can, read and understand, and you decide, yes, I want to use this, no, I don't. And then you can feel confident about seeing how you can move it forward in practice.
For sure.
That's great, guys. Thank you very much.
Mindy, thank you for sharing your story. I'm sorry, I just noticed in the chat there that was a really great question, and keep advocating. I think that's one of the things with us nurses is that we do have a voice, and RPNs, we do have a voice.
Thank you, Christina, Ben, and Jen. That was really helpful for bringing us, Christina, a real life problem and information about the levels of evidence, Ben, unpacking the process of critical appraisal and finding evidence and research articles to solve that problem. The demonstration of the step-by-step process of finding evidence without the assistance of a librarian or an expensive resource, I think that was very helpful and is effective in learning how to make this stage of gathering information less daunting and providing evidence quite readily at our fingertips. JP, do we have any questions that we want to answer from our audience?
I didn't see any other questions, just the ones that Ben and Jen already answered. So I think that was all of them. Does anyone else have any questions they'd like to put in chat for our panelists?
Okay, if we don't have any further questions right now, maybe we could move to Dr. Nancy Snoblin, our research consultant, and she can tell us about some of the upcoming research activities. And if anyone has any questions, maybe we can answer them after Nancy shares her update.
Thanks, Annette.
That's good.
Thank you, Annette, and thank you to our presenters. I'm really looking forward to part 2 of your presentation on April the 5th. And I think we want to encourage anybody that attended today to really think about what is one of their clinical problems and how can we help them find evidence to solve it. And Mandy, you brought up a good situation, so hopefully you bring your evidence forward. I just want to give a quick update on our research activities that's active right now. We have 4 research programs on the go. First, we have a Social Sciences and Humanities Research Council of Canada Partnership Engagement Grant, and it's on resilience of the RPN working in the home and community care sector. We're currently recruiting interview participants, and each participant would get a $75 gift card for the 1-hour interview. So if you are interested in participating in that research project, please email me at nsnoblin@werpn.com. And you have to be RPN, registered with the college and working in home and community care sector. The second thing is we have a Healthcare Excellence of Canada grant regarding co-designing virtual pieces care planning framework and toolkit in long-term care homes. And that's to support how to implement and use a virtual pieces framework with patients and families and caregivers. And it's to promote shared decision-making with residents. And we just want to make sure that the residents and families have a choice around virtual care, and the team plans the needs of the patient based on the resident needs and capabilities, their care requirements, and the clinician capacity. We did an initial study around this and found that the video conferencing in long-term care brought the residents and families much closer to the team than just telephone contact. So the third study for BEGIN, Bridging Educational Grants in Nursing, we're doing a province-wide survey asking nurses to complete a brief online survey about perceptions of working in different Ontario healthcare sectors. That's currently underway. The researchers are trying to understand what creates a desirable professional workplace and in whatever sector within Ontario. They also aim to discover what could or would make long-term care and home and community care settings preferred places to work. And fourth, we are also excited about having the 22-23 WeRPN funded research projects, 2 academic research studies and 2 RPN research fellowship studies underway this year. And one of our speakers, Jen Calver, is one of those research fellows. On a final note, WeRPN call for RPN research fellowship proposals and call for academic research proposals that opened in November 2022 will be closing March 31st of this year. It's not too late to submit your 1-year research and or fellowship project proposal for funding consideration. And those are to begin July 1st, 2023 and end by June 30th, 2024. So thanks to all who responded to our recent request for participant recruitment in all the research studies which are currently active and ones in the recent past. And we appreciate you continuing to step up to be the voice of RPNs in research. This is how we grow the evidence. And I'm hoping that we see you again on April the 5th for part 2. Thanks. Back to you, Annette.
Thank you, Nancy, and thank you all for joining the WeRPN Research webinar this evening, A Thriving Clinical Practice, Finding and Using Clinical Practice Evidence, Part 1. And in review, as part of our entry to practice competencies, RPNs are expected to advocate for, use knowledge, critical thinking, critical inquiry, and research to build an evidence-informed practice, and to help support making decisions with clients that incorporate research, clinical expertise, client preferences, and other resources. So we hope this webinar supports your practice and the care you provide within your practice settings. Please remember that evidence comes from many sources, such as peer review articles, academic studies, and that they can sometimes be difficult to clarify, interpret, implement, and use. So the intent of this webinar this evening is to provide a new way to finding and reviewing literature. Also remember that education, such as this webinar, can help you with this process, and we hope you leave this evening with a better understanding of how to translate evidence. And finally, we recognize that not all RPNs work in roles where they have access to librarians or databases or professional practice mentors and supports that are available to help find and use evidence. But I think now that you have completed part 1 of this webinar series, you have some insights into helpful ways that you can assess and review literature. As to all our members, please remember that you can reach out to our WeRPN practice associates at any time if you need assistance, whether it's for a clinical issue or just to ask questions that will help support your practice. And for all of you that are going to attend part 2 and want to go over this at a later time, this recording will be available on the WeRPN members only site for our members to review. We look forward to seeing you on April 5th for part 2. Good luck finding that article of interest for our next discussion. Some of you already have one, like Mandy, and thank you presenters and all of you that took the time to join us this evening. Good night.
Have a good night, everyone.